Hey everybody, thanks for joining me today, Dr. Ross Marcagiani at Turnpaugh Health with another great word of the week. Today's word of the week is going to be polycystic ovarian syndrome, also known as PCOS. We'll be talking about what PCOS is, what are some common symptoms of PCOS, we'll be talking how we test for it briefly, and then how do we help those women who are suffering from PCOS. Let's dive in. So first thing, what is polycystic ovarian syndrome? So if you look at in typical literature or medical literature, it's considered idiopathic or of unknown etiology. Basically, how it starts is unknown. It typically affects about roughly 15% of all women and is one of the larger causes of infertility. Some of the results of polycystic ovarian syndrome now, is it a result or is it causation? It's tough to decipher, but we know that with PCOS, it causes for elevated androgens. Mainly the androgens that are seen most common to be elevated are testosterone, your DHEA, dihydroepiandrosterone, androstenedione, and then also we would want to make sure you look at estrogen and progesterone. Those can be seen to be elevated as well. Not as common, but something you want to make sure you assess. Commonly, we've seen hyperinsulinemia, so high levels of insulin or uncontrolled levels of insulin, and then impaired fasting glucose, so high levels of blood sugar and hyperinsulinemia kind of go hand in hand. So looking at blood sugar, right, and then hyperlipidemia, high levels of LDL, total cholesterol, other markers that make up your lipids. These are contributing factors or results of PCOS. Polycystic ovarian syndrome, as you can tell in the name, results in, as you can see here, several cysts that form in and around the ovaries. A lot of the time, symptoms can mimic somewhat like endometriosis. So PCOS and endometriosis or even adenomyosis get mixed occasionally, but they are very different. We can talk about the latter of the two at a different topic because today's about PCOS. And then the other aspect that a lot of people talk about with PCOS is a little bit of a bigger word here, is post-receptor defect in insulin mediating signaling. So basically what this phrase means is that it's not so much that they're seeing that the insulin binding to the receptor, it's the insulin binding to the receptor, and then the cascade of signals that need to be sent after that are what being affected in polycystic ovarian syndrome or in hyperinsulinemia. Remember, high levels of insulin, which can cause for a slew of issues here. But we're going to talk about how we can address these. So that's PCOS in a nutshell here. What are some common symptoms? So infertility, amenorrhea, meaning not having a cycle or skipping your menses, menstrual irregularities, longer or shorter cycles, hirsutism, which is irregular hair patterns or irregular growth, whether on the chest, armpits, facial hair, acne, male pattern baldness, obviously weight gain, obesity, sleep disturbances, depression. Obviously, as you can tell, if we're forming cysts, the ovaries are going to enlarge, and that's going to create more back pain, more cramping, and potentiate further PMS symptoms. And obviously the infertility being the big one, which we already discussed. Now, some testing. Gold standard testing for PCOS is doing a pelvic ultrasound and being able to actually be able to see those follicles or cysts, actually on the ovaries. You can also do some other blood work here, which is important to do. This is just a little bit of blood work to encapsulate PCOS. So like we talked about earlier, elevated levels in androgens, so looking at your testosterone, looking at your DHEA, your androstenedione, looking at the estrogen, progesterone levels. We want to make sure we look at your glucose. We want to look at your insulin, your hemoglobin A1C. We want to look at your vitamin D because you'll find out that that's an important factor in this. We'll want to look at lipids like your LDL, HDL, triglycerides, cholesterol, and even in some cases, thyroid markers, because there has been some research making a connection. Now, you know, uh, um, correlation is not always causation, but there is some connection with thyroid and thyroid dysregularity or hypothyroidism in connecting to polycystic ovarian syndrome. So how do we help here? How do we help these women suffering from this? So I always recommend nutrition be your medicine first and foremost. So we want a low sugar, low carbohydrate diet. I love, as my viewers know, paleo diet. It works great. Trying to limit your carbs to around 20, no more than 50 grams, but that is weight dependent. Usually consuming around 2,000 to 1,500 calories. Again, that's weight dependent. Is a safe bet, but high, good, adequate, lean protein, good, moderate fat consumption. Your carbohydrates should be consumed from vegetables and good, adequate fiber sources. We want to try to maintain insulin and blood sugar, so exercise levels help to regulate and actually sensitize the insulin and glucose receptors. So not in the goal to lose weight, because these patients typically have a difficult time losing weight. And some of these women aren't overweight. They're not obese. That's one thing to be aware of as well. But exercise can help, as I just mentioned. And then some supplements that you can look into, D-chiroinositol and D-phenol have been shown in many cases of polycystic ovarian syndrome to be low. Again, the correlation is not always causation, but there has been a lot of research supporting the use of these two supplements in helping lower androgen levels and helping improve insulin levels in polycystic ovarian syndrome patients, and actually have allowed patients or females who were amenorrhea, not having their menses, actually get back to having their menses. You can find D-chiroinositol high levels in buckwheat. Your D-phenol can be in the fiber from fruit. Just be careful, again, that will bring up your sugar, so you don't want to do a ton of fruit, but also fiber from your vegetables, your cauliflower, your broccoli, those good cruciferous vegetables. We want to make sure we're taking adequate vitamin D. Vitamin D helps to control and modulate glucose response, so really important. Chromium is really beneficial because it helps to sensitize the insulin receptors, right? So really important that we do that. N-acetylcysteine helps to improve as well the sensitivity of the insulin receptors. So mainly your vitamin D, your chromium, and your NAC are going to help with insulin sensitivity and glucose sensitivity. And as I talked about earlier, checking your thyroid, really important that you don't want to miss that marker. Check the lipids, making sure we're not, suffering from hyperlipidemia or other lipid issues. I hope this video was helpful. If you know anyone dealing with this, please share this information with them. Thank you for your time and have a wonderful day.